Asymptomatic testing is no longer recommended for other Albertans who have no symptoms and no known exposure to COVID-19.
Heading into the cold and flu season, Alberta Health is pulling back on who can get asymptomatic testing across the province.
We and every other province in Canada must prepare for a surging demand for tests this winter. We must prioritize our testing, especially as we prepare for the flu season, to ensure that testing is scheduled and results are returned as quickly as possible.
Back in May, Alberta was the first province to offer testing to anyone, regardless of whether or not they had symptoms. Results from that data show that positive tests were found 7 times out of every 10,000 tests completed. Moving forward, asymptomatic testing for those with no known exposure will be reserved for people who are at risk of spreading it to vulnerable people.
This includes residents and staff in congregate settings, healthcare workers, school teachers and staff, and Albertans experiencing homelessness.
Anyone who has a test already booked can proceed, and those who are traveling internationally and need a test to fly are still eligible to get one. Over the past 24 hours, Alberta labs completed more than 13,000 tests, finding 146 new cases. There are 1,483 active cases in Alberta, 470 in the Calgary zone, 751 in the Edmonton zone. 41 people are in hospital and 8 in the ICU. No new deaths to report. However, AHS is reporting 64 cases at 48 schools.